Today on the Practice Profit System, you are going to hear from Dr. Daniel Paull. Now, why do you want to listen in on Dr. Daniel Paull's interview? Because he is not your traditional doctor. This is a guy that went to med school, was in fellowship, and realized that the system sucks, okay? And he found out about direct care in orthopedics and had a friend of his that was doing it. And he created a company called Easy Orthopedics. He has no office. He has, quote unquote, no patient list, no EMR, and he's making as much as an orthopedic surgeon would, treating patients with house calls. Check out the interview. Enjoy. This is Matthew Galogli. I am your host today, and I have Dr. Daniel Paull, who is located in beautiful, sunny, warm Colorado. Here's why I love Dr. Paull and why I'm really looking forward to today's conversation, because when you go to his LinkedIn profile, here's what it says. Orthopedic surgeon, pioneer of insurance-free and mobile orthopedic care, antagonist of health insurance and large hospital conglomerates. That's a pretty good bio right there. So how long have you been an antagonist? And did you study that in college?
Oh, man. Well, first, thanks, Matthew, for having me on your podcast. No, did I study that in college? No, actually, I studied physics. It's kind of a funny story. I didn't set out to sort of do this. It kind of happened by calamity and accident. But it allowed me to sort of get my head to take a few steps back and really get a good look at everything. And like the more that you look at it, it's just a really insane system that a lot of docs just are institutionalized in. It's kind of crazy that we just keep doing what we're doing. So once I sort of had a realization of that, that's really when I became an antagonist. I mean, because you can't run a cash-based practice, which is what I have, without sort of being an antagonist of that system. And that system wants you to work inside it. So, I mean, just the very fact of being liberated from it sort of makes you an antagonist of those systems who ultimately want to control and commoditize you as a physician.
Okay, so you went to Miami, University of Miami med school, right?
For med school, yeah.
Right, so you kind of went on the traditional path, right? Like, what was the epiphany? When did it kind of come to you that, like, wait a minute, this system is kind of jacked?
So, I mean, my personal, with me, I went to University of Miami for medical school, and then I went to University of Toledo for my orthopedic surgery residency out in Ohio. And at that point, I was just planning on going into the system and getting a job and just being very much in it. With residency, you're so busy learning, and it's very labor intensive. You're not really looking at anything else. I mean, you get paid, in my opinion, a fairly small salary for what you're doing, especially during the later years when you're really running things in a certain sense. And so you're not like RVUs, insurance. You have to do that if you want to do orthopedic surgery. Like, you have to do that. So that was what I was doing. And after that, I started a fellowship in hand surgery. And suffice to say, you know, a lot of people go to their fellowships and they're like, oh, it was such a wonderful year, blah, blah, blah. I learned, had mentors. I wish that was my experience. It really just wasn't. It was not a positive educational experience. I don't really know how else to say it. But anyways, so I'm halfway through that. It's only a year, optional year, right? I've already finished 4 years of med school, 5 years of residency. I've passed part one of my boards. I'm in my fellowship. I'm halfway through and I'm unhappy. And then, so that's one thing. The other thing is I'm looking for a job. Now, my wife is from Colorado. And at this point, I've dragged her all over the country.
Are you struggling to translate your amazing medical skill into cash-based procedures? We have the solution. It's called the business of orthobiologics. And we want you to join us. We host this event a number of times throughout the year. Myself and Dr. Ariana Demirs are going to teach you the science of medicine, and I'll teach you the science of business. And you'll find how to add $50,000 of cash-based procedures in the next 60 days, or we'll give you your money back from the event. Join us. Click the button below. You'll never attend an event like this ever in your life. It'll transform your life and your business. Join us.
And she's been, we want to go back to Colorado. That's where her family is. And it's nice out here. And that's where we want to live. And we weren't super picky. Her family's in Colorado Springs, which is an hour south of Denver. And we're willing to live anywhere on the Front Range, And it's like, man, I just can't find a job. Like, I can't find one. Or if I do, it's like, really, it's abusive at best. Like, hey, take our entire call for our entire practice, or here's a 4-month guarantee for you, and then go figure it out on your own, which is, most guarantees are 2 years. You really can't build a practice in 4 months unless you got extremely lucky, or you inherited one that already existed. So like that's going on, right? And then, so I interview for a job because I can't find any in Colorado, out in Connecticut, and that's where I grew up. And I remember going there, you know, it was like on a Wednesday, I had to like leave fellowship and drive there and, you know, whatever. And it's just this old senior partner just telling me how much money he made in the 90s and how bitter he was really about everything. That's the sense that I got, because there was a hand surgeon that left.
How much money he made in the 90s. That's great. Back in the day.
Yeah. And then he was just so mad at this guy that left. You know, it wasn't a good, like, it was kind of a red flag. I'm talking a lot of junk about the guy who previously left. So I talked to a junior attending, and I'm going to see if I can do this right. But I talked to a junior attending. He's like 2-3 years in. He's a sports guy, sports trained guy. And I'm like, do you like working here? Right? Simple question. You know, you expect most people to be like, yeah, it's pretty good. It's all right. He was like, it's getting better. It was like this really like, that's how it sounded. And I was like, oh my God. And like, he didn't have sports cases. He was on call. He was doing his own reductions in the ER, which if you're an ortho guy, that's not a good sign. It was just, I'm sure he was getting lowballed, because that's what they were like, floating lowball offers around. So I was like, oh my God, like, what is this? Like, it created this sort of existential crisis where I'm like, is this what all the jobs are like? Is this just what, you know, you grind it out for so long through training? It was this realization like, oh, this sort of like existence is forever. Like this does not get any better. And like, I think that's the only way you're sort of able to make it through training, is by knowing like, okay, it'll get better when I get out. It'll get better when I get out. And I guess I had this existential crisis where I'm like, oh, I don't think it will. It might even get worse. Mm-hmm. So it was that combined with this fellowship. And I was just like, this is it. I'm like, I got to do something differently. So I quit my fellowship, which is not normally done, but I did it. I broke my lease. I moved into my in-laws' basement out in Colorado. I have one friend from medical school, and he started a cash-based practice doing internal medicine, where he would basically, you know, he was doing house calls in South Florida. And I'm like, you know what? This guy's happier than anybody I know in the medical profession, and he's doing better financially. I'm like, there's got to be something here. So that was sort of it. It was really kind of a desperation move. I was in Colorado Springs already. It's not like it's super saturated with orthopods. It's not like I could find a job. You know, I didn't want to move. So I just had to create my own practice, and taking insurance wasn't an option, because it would have led to a very quick death. It would have led to a very quick failure, because I don't want to hire 5 people per. I mean, that's what I'd have to do. And I'm not going to do it as better as the other larger guys. I'm not going to get good contracts. And it was sort of like, all right, well, I can't go that way. Let me start with cash. And then as I did it more, I'm like, wow, this is so much better than what I used to sort of do, or the system I was in. And like, there's a whole subset of people who don't have insurance or who have high deductibles, and you are the most economical option for them and a great fit. That sort of became the beginning of me being an antagonist of those systems, is just being outside of them, and then just really seeing how bad it is inside, and seeing how doctors, I mean, really the best word is like, you know, it's like in the Shawshank Redemption. It's like we're all institutionalized in this terrible system. We can't picture another way of doing it.
Yeah, that's so true. I mean, I see it from the different side of things, right? Like, so obviously, clearly, I'm not a doctor. I got in medicine by accident in 2013 because a guy told me I needed to be in the erectile dysfunction business. And when I got inside the system, and my first wife at that time was also going to nursing school, and she was working in the ER, and I'm like, this is jacked. Like, this is totally insane. Why in the world would you do all of this to come out and be treated as poorly as you are? Okay, so I want to talk about your business model in a little bit. And I know you have a book or you have some other stuff, but we'll get to that as well. So what I'm curious about is, it sounds like your path has been pretty traditional up until a point. How did you start to learn the business side of this? Are you a naturally gifted business guy? Do you come from a business oriented family? Or are you just figuring this crap out as you go along?
Yeah, probably the latter. I didn't have any business training. Certainly don't have an MBA, nor do I really want one. But yeah, it's trial and error, right? I mean, it's just small, like, you know, making decisions on a small scale, like what makes sense and what doesn't. And then learning from the mistakes that I've made and trying not to make any big ones. And over time, I feel like that's given me a pretty good business sense. You know, I also educate myself, you know, by reading, mostly with just free books from the library. I mean, you know, digitally, of course.
Yeah.
But
yeah,
that,
you know, God forbid we should actually go to the library, right? I'm just joking.
I know. The library is amazing, by the way, for those who are listening. I mean, you get a library card. It's all digital. I mean, you can just get stuff sent to right to your Kindle. You don't even have to go anywhere.
I will tell you this, like I've built, you know, when I first started my first entrepreneurial journey, I would live in the library. Everything's free. It's great. And now we have the internet, but yeah, keep going.
Yeah, it was just trial and error and figuring it out. And, when you're limited by certain constraints, it makes, forces creativity to kind of figure out ways around these problems. So I kind of just tackled them one at a time and, move forward. And I feel like over the years now, it's been almost 5 years I've been doing this. I feel like I've got a pretty good business sense now as things have been growing. And I mean, I started off with like nothing, and the model was new. So, it's a really slow start with this sort of thing. But I was able to get past that early stage and just because I had to, I guess.
Why do you think the lack of business knowledge exists in the medical field? You've been through the system, I haven't. Why? Why does it exist? Why is there not at least one freaking class?
So, gotcha. Doctors are terrible at business. I'll get into that in a second, but here's one of the big reasons why, right? So when you go into medicine and you end up working in a hospital, you're going to see certain system practices that are very obviously bad and inefficient, right? I'll give you an example, personal example. So I was a third-year resident. I was at this hospital. We're doing pediatric surgery, and the kid needs surgery. You need to get a consent, obviously, right? No one's going to debate that. You need to get a consent. So you fill out the consent. You fill out the consent by hand. And then there's a box where if another parent's not there, you could check this box, and then you call the parent and they can say, I give consent, and someone witnesses it. So both parents consent, right? It's a good process. The problem is that if there was a second parent, you had to hand copy the first consent, even though there was a checkbox on it. So you basically had to do two consents and copy them out. And so it could easily be one piece of paper. I know this sounds silly because it's just a piece of paper, but I think it's a good explanation of how what I'm going to get at here. And so you'd be like, hey, this is kind of silly. Why are we doing two? And it's not like they're like, well, of course you get this is the way we've always done it, right? Which as an entrepreneur, it's like,
yeah, that's
the worst thing someone can say to you.
Yeah.
But also you get in trouble. They beat you down. They report you. You get in trouble for even saying stuff against that. So, you'll see these essentially immutable hospital system practices. And at first, at least with me, you're like, this is ridiculous. Like, why are we doing it this way? And you get beaten, man. You get beaten into a pulp. And you get in trouble enough times for stuff like that, you stop doing it. So what ends up happening is you be smushed into this perfectly formed, shaped cog, where you realize that to go against the grain is so painful that you stop doing it. Any creative idea you have, any ability to take risk in that way, it's gone. So by the time you get out of that system through medical school and training, which is close to 10 years for a lot of people, you've been formed into a perfectly forged in the fire cog, and you don't have the capacity, or it's latent, it's smushed down somewhere in the middle of that cog to basically take risks and be creative. And when you come out, you're just like, you need those two things to be successful and make good business decisions. And while some of us may have them, there certainly have been suppressed. So for me, I was lucky enough when I left in such kind of a calamitous way, I got those things back, and I think that's helped me be successful. But yeah, you have to be able to do that. You need to be able to be creative. You need to be able to take risks, and that essentially is untrained out of us in medical school.
Well, isn't it fascinating? Yeah, to me, it's fascinating though because 2 points on that. One, the entrepreneur life is all about risk and breaking what's not, and just asking why. Right? That's how you make a living as an entrepreneur. And you're right; it is beaten into you that you should take zero risk. Which I think is hilarious because isn't really medicine, if you look at medicine 100 years ago, wasn't it really about risk of let's try something to, like, think about the advances that have been created by people in the field saying, you know what, this is a crazy ass way to do this. Let's try something different. What are your thoughts on that?
Yeah, certainly like way back when, before we had IRBs, people did all sorts of stuff for better or for worse. And there's a lot of medical advances and also like things that probably shouldn't have been done that were made that way. And I think as far as the advancement of the field, like from a medical standpoint, doctors are still, a lot of people are in research. A lot of people are looking for, that sort of scientific discovery sense is still there on like the educational, intellectual side. But on the business side, like none of that's there. So I don't know. It's tough. Like you're encouraged to do research and, find better ways of doing things in that way, but not in really like the business model of delivery. It's kind of like, hey, don't touch that. Like this is sort of the way it is. Like you have to do all these ridiculous things. Like you have to contract with insurance. You have to work with hospital systems. And that's just not true. But again, somebody's making a lot of money off of docs, commoditizing us to basically, they take advantage of our wanting to do the right thing and, go the extra mile for people, which most docs will do. And then we get taken advantage of because of that. And, we become commodities to a lot of people to basically make money for them. And so we're very, very much stuck in these systems.
I'll never forget this. So I was at an event in 2007. So, gosh, what is that? 15 years ago, 18, 16 years ago. Anyway, so I'm at this event and I'm there with a guy who's doctor. He wasn't a GP, but he was either OBG or it wasn't like he was just pushing paper. He was in it every single day. And we were at a conference, and I will never forget this. The guy in front of us collapsed, right? Now, he was either having a heart attack or he was whatever. And a bunch of people jumped in, and I'll never forget this. This doctor, friend of mine, knew him very well. I go, aren't you going to jump in? He goes, if I jump in and he doesn't make it, I'm going to get sued. He goes, I'll stand here and I will give direction, but I will not jump in. He said, my hospital will kill me if I do that because we're not in the location. I'm like, are you serious? That was my first revelation of like, this is really screwed up.
He said, like, who would kill him? His hospital would kill him? Is that what he said?
His hospital would give him a rass of shit if he went in and jumped in and performed CPR. This was at a conference. And he said, he goes, I can give direction and tell people what to do, but they don't want me jumping in. I'm like, wow. Because of all the legal risk and all of that. I was like, I'm sure that's an isolated case, but that was when I had kind of a major epiphany of, wow, the system really needs some work.
Yeah, that means somebody probably told him that. You know what I mean?
Yeah. It
was probably a topic that was covered during something. There's a good Samaritan law. You're supposed to be protected for that sort of stuff anyways. So I don't know from a legal standpoint that really holds any water, but that's crazy, man.
Isn't that crazy? All right, so let's go back to the business side of this. How would you change the structure of medical school and residency, knowing what you now know? If you were to go back, let's say I make you the dean of medical school at University of Miami or wherever, what's the matter with you? What would you add? What would you change?
So there's always a discussion of adding business courses and everything to medicine. But I think that, you're looking at small business, which is very different than big business, which is why I think an MBA and that sort of thing is really not super helpful. Actually, I think it can be the opposite, actually be hurtful in some ways. But I think the question is, how do you let them know? I think the first thing is letting them know that their direct care and cash-based practices are available, and at least having them rotate with docs who do that, and not having them talk to docs who don't do that. Because the problem is in that level is every once in a while I get approached by a med student who has a question about it. And they're like, I talked to my faculty, they all said it would not work. I'm like, oh, all of your faculty who are employed by the school, who barely work anyways, who have zero experience in direct care space, they're telling you it won't work? They may be very intelligent and good doctors, but they don't know what they're talking about. You got to find out from people who are actually doing it. So that I think would be a good thing in medical school, just to open med students' eyes to that, even just to rotate just a little bit. They don't have to do it a lot, just so they can see like this is another way of doing it. And then I think in residency, you don't have any time for anything really. So I think those courses those things would not be useful. I think in residency, you more need cautionary tales. I think you just have someone who comes in every once in a while. You have these lectures every week, and just for one of the lectures every once in a while, cautionary tale like, hey, I bought too big of a house and too nice of cars, and I got signed a non-compete, and I got stuck and divorced and miserable. Don't do what I did. Like, okay, residents will remember that, just stories, or like, hey, I was in this terrible system, I created this own practice, and actually you can do it like this and it works great. Keep it in mind. Be like, okay, and to the point where there's absolutely zero exposure. As far as business skills itself, I think you kind of have to learn those from mentors, or at least on the small scale, or following people who have already done it in that way. But yeah, I think that because a lot of people want to put courses in, I just think it would be tough. These med students are so overloaded with information already. They're just they won't listen. You need stories and experiences, I think, would stick a lot better for the limited time that you have to teach these things.
Have you ever gone to a medical event, medical conference, learn a great new medical skill, and you get all excited about how to go home and you're going to sell this to your existing client base, and you go back and guess what? Nothing happens. Maybe you sell one or two of the procedures, but all those dollars that you had bouncing in your head of how much money you were going to make, well, they don't seem to materialize. Well, the reason why is there's a gap. And the gap is that no one has ever taught you how to marry the science of business with the science of medicine. That changes with what we call the business of orthobiologics. And this is an event that is hosted by Dr. Ariana Demirs and myself. We host it a number of times throughout the year, and it's a 2-day event. And what it is that Half of the event is about the medicine of orthobiologics, and the other half is about the science and medicine of business, if you will. So what we do is we show you how to marry all of that. And what we find is that our average attendee adds $50,000 of cash-based procedures to the practice within 60 days. Want to find out more? Click the button that is here below or click the link and it'll take you to the page where you can read more about the BOB, the business of orthobiologics. It's a one-of-a-kind event. No one else is hosting an event like this throughout the entire country, and we want to help you grow your cash-based practice. Join us at the BOB. Find out more details by clicking the link below. What are your thoughts on this? Some of the states have moved to capping the number of hours a doctor in residency can work. I know like the state of New York, I think it's down to like 85 hours in a week. Whereas you hear these stories of working 115, 120 hours, 130 hours a week, being up for 3 straight days. What do you think is there a negative impact on medicine for those that are working those kind of insane hours?
Well, the workout restriction is pretty much universal across the United States. It stemmed from a case, I think it was in the 80s or 90s. It took a while for legislation to get passed. I think it was Libby Zion, where a reporter, their daughter, like had a bad adverse effect and died in the hospital. She was like a teenager or something. And they asked the residents, and they're all like, "Oh, we're just so tired. We're so tired." And that kind of sparked the change. So, I mean, if you talk to old docs, they'll tell you you're not going to learn anything only working 80 hours a week. I would say that that's wrong. It's a lot of time to be spent. And there's also the quality of the hours that are spent. Are you doing scut work for 60 of those hours? I mean, if you're working 80 versus 110 or extra 30, 40 of those hours just scut paperwork, like you can improve the quality of the education without necessarily improving the quantity. You essentially get 10 years of experience in 5 years by working essentially double full time. I don't think increasing the work hour limit and having super sleepy docs is really good for anybody. I don't know how much you learn either when you're working that much. You're pretty much in survival mode, but again, medical institutions, this is the way we've always done it. It took a lot to change that. And I think for the better. I don't think we were doing anybody any services by keeping work hours, unrestricted like that. I mean, look, 80 hours, if they're quality 80 hours, that is still a lot. I mean,
that's a lot of hours. Yeah, you can't.
It's not, you can't process, I've hit 80 hours. Usually if you hit 80 hours, you work in an overnight shift or something. But I've hit it just Monday through Friday before. It's a lot. You're getting up, going in really early, working all day, coming back really late, and just like eating, using the bathroom, and going to sleep. I don't know. But of course, you'll find these old docs who like, I worked 120 hours, It's this classic mentality like, well, was that a good thing? I mean, do you want that to continue, or you want to keep torturing everybody for no reason? I don't know.
Let's talk about Easy Orthopedics. Let's talk about what you're doing today, because I think this is a fascinating thing. So you do mobile orthopedic care. Tell us what Easy Orthopedics is. Let's talk more about this journey.
Gotcha. So it's a cash-based practice. So I don't contract with any insurance companies at all. And by cash, I just mean that I don't have to interact with an insurance company. So if I see a patient, they can submit to insurance, right? I'm not submitting. I can give them everything they need. Or if it's medical legal work, I don't have to interact. I get paid in advance, don't have to interact with an insurance company. Personal injury work, I don't have to interact with I have to interact with a lawyer, but I don't have to interact with an insurance company. So it's really anything where you don't have to. And the reason why I say that is because if you do interact with an insurance company, you've already ruined your practice. Like I said, 5 people per, changes the way you code and you bill, and it shoots the overhead up to the moon. And then you're all of a sudden running a high volume practice. So by nature, a cash practice, at least the way I run it, is sort of like a low volume, a low overhead practice. Does not mean low revenue, which some people falsely think.
Or low profit. Volume, doesn't mean it's probably way higher profit than what you would be doing in the insurance world.
Oh yeah. Right. I mean, per hour, I don't, you work significantly less than you can earn the same or more, depending on how busy you can get. But, at your max, you're still working significantly less. I mean, I'm not working at a hospital, so I decide I don't take call. There's a lot of pluses here that sometimes people miss. But yeah. And so the mobile part, when I started, obviously I couldn't afford a lease. And my friend in South Florida did a mobile. So I said, I'll try that as well. So started off as pretty much 100% house calls, and I carried everything. Wait a minute,
you're doing orthopedic house calls,
Yeah.
Is that like what that tub is behind you in that bag? Is that it? You just walk in with that
stuff?
Yeah,
those are all my supplies. Yeah. So in that bag, I know it's at the corner of the screen there. I've got a little ultrasounds. I've got an iPad, all sorts of injection supplies, sutures, wound care. It's all condensed in there. Yeah. So that's
so cool.
I started that way doing house calls. Then after a while, I'd see people in the community, other docs, and they'd be like, hey, can you see this person at my office? We're coming in at 9. And I'm like, okay. So I started going to these other people's offices and seeing people there. And then after a while, I had all these offices I was going to. And then they start letting me bring my own patients there. Now, some people may say, well, I get this question, how did you negotiate the leases and whatnot? And I'm like, I didn't. We don't exchange any money. And I think this is a problem with doctors. We devalue ourselves. So when I am there, I am a value added service, right? I'm not using their front office staff. I'm not using their EMR. I'm literally only using the room. I bring all my own supplies. I clean up after myself. So I am literally using a room when no one else is using it at these offices. And I'm a value added. You have an orthopedic surgeon coming into your office. And for a lot of practices, that's a plus that they can say and market, and the people that get it. So it's not like I'm in there all the time. And so they don't charge me, and I bounce in and bounce out, and I'm very small footprint. And that's how it works. Now, of course, that won't work with everybody. They have to understand the value add that you give. But let's say for like a chiropractor, they're worried that if they send them out to the ortho practice in town, they might never come back. So for me to be able to see them at their office, it's a big value add.
Oh, that's brilliant. I mean, we have a number of clients of ours that are chiropractic, and they've partnered with a doctor to provide regenerative orthobiologics, right? And their patients are happy because there's a bunch of patients that they can only take so far. So you're not doing any more surgery these days, right? Are you done doing surgery, or are you?
No, I still do them.
Okay.
But they've kind of moved them to like smaller stuff that I can do in a procedure room. It's like under local. It's like Dupuytren's, carpal tunnel triggers, cyst excisions. So that at the current moment, that's sort of what I'm doing. I've done more invasive stuff before when I used to work had access to the surgery center, but that's always sort of been a work in progress. I still do it. I still have to do labs regularly to keep my skills up. I mean, I have to make sure my cases that I'm doing are relatively straightforward because I'm not operating as much as I'm used to. But no, I still do it, believe it or not. That's been a hard part to build into the practice. And I could certainly be very profitable without doing any of it. But it's something that I feel like I can do and I like to do. So I still do it.
What is the reaction to the patients when you tell them you do not take insurance? Because the general consensus with most doctors is that if I don't take insurance, nobody's going to want to work with me.
You mean, so the reaction of the patient?
Yeah, the reaction of the patient.
Well, a lot of times they're really happy about it because they found me. Because like I said, they have a high deductible, they don't have insurance, and they do the math and they realize that I'm the most economical option for them. So they're very happy to find someone who has transparent pricing, can get them in quickly, take care of them, and has good communication. So I think it's most people are pretty happy about it. Yeah, you get the calls or like, well, I have A, B, C, and D. Do you take, Medicaid? Do you take United Healthcare? And we're like, we don't. They're like, oh, okay, which is fine. We don't end up seeing those people. But I think as health insurance gets worse and worse, meaning that premiums get higher for patients and they cover less and deductibles go up, I think you'll see more people start thinking about using cash for care, which I think is the way to go that's what I do for most things that they need. Again, we're so institutionalized in this country. We think like you just have to have insurance. And on the other side of the coin, you certainly don't. I don't have it. I use a health share. I use direct primary care to cover my own personal needs. But yeah, docs think that like if you do cash, like, I don't know, there's some fallacy that like we're only treating like healthy and wealthy people and we're just going to super rich people's houses, and it's just totally wrong. You get some people like that, but the majority of people are really getting squeezed by the system and are serviced poorly, and you're a real godsend to them. So I think a lot of docs falsely assume that. And these are also docs who aren't involved. They don't have any knowledge of direct care. They like to think that the way they're doing it is the way they have to be doing it because they're suffering. And they don't want to think that there's another way they can do it where they don't have to suffer in the same way. So, you get some pushback from docs as well.
Yeah, I think you get more pushback from docs, quite frankly.
Yeah.
I've been in this space for 10 years. And, so the latest statistic, and I'm sure the number is going to change, but the statistic at the beginning of this year was, the beginning of 23, is that 60% of Americans are in what the government deems a quality healthcare plan. I'm not sure what the government quantifies as quality, but we'll just leave that definition alone. And the average out-of-pocket deductible for a family of 4 is $10,000. And it's something it's something stupid like only 30% of the people hit that deductible. So, and if you look at what just happened, as a business owner, I have all my close friends are business owners. They are experiencing an 85%, on average, 85% increase on their fees, their insurance fees, their insurance rates.
It's a scam.
It's a scam. And then on top of it, they're reducing the coverage, right? So they're like, not only have my fees gone up, but they're reducing this and this and this and this. And we've gone, in our company, what we're moving to is, I'm just, because I have a contract, I have the ability to connect obviously with all kinds of great doctors, is like, look, we'll just provide catastrophic care, whatever that is, right? And we'll give you money to go pay for your HRT and all the good stuff to help you stay in your functional medicine stuff. Because it's just, it's such a scam. I mean, how did we get to this place, Dan? Like, how did we get to this place that it's such a fucking scam?
I mean, gosh, it is such a scam. I mean, you're talking like, all right, so you hear people say this all the time, like, well, I don't know, my insurance paid for it. It's like, who's paying for your insurance, man? It's you and your company. Your company is putting out a lot of dollars, and you're putting out a lot of dollars for the premiums to have the benefit of having insurance. Now, that money if that money went to you, everybody would have a giant salary increase. I mean, like thousands of dollars a year. But it's not. It's going to the insurance company. When the premiums go up every year, guess who's not getting a raise? You may be. I mean, you are getting a raise, actually. It's just going to the insurance company premiums, not going into your pocket. So every year there's premiums go up and the coverage gets worse. I mean, you're talking like $8,000 deductible and you're paying $2,000 a month. I mean, like you have like 20 grand before they pay that first dollar, and then you go out of network, they won't even pay that dollar at all. So yeah. How do we get to this place? Well, I think that you have to go back a long way. So in World War, there was wage freezes. So you couldn't increase someone's wages during wartime. And so what some employers did to attract people were they would start offering major medical coverage, meaning that if you had to go to the hospital, they would pay for it. Now, at the time, it was much, much cheaper. There weren't many things that you could do. And it was like, it wasn't the monster that we have today. So it was significantly cheaper. So that's kind of how benefits got tied to working. And it's kind of just kept ballooning. And I think as time has gone on, and I think the Affordable Care Act certainly accelerated this process.
Oh, yeah.
These companies, these insurance companies and the hospitals and pharmaceuticals, they figured out they started making a lot of money, and they're just kind of leaning into all those things that make them money. So for insurance companies, it's charging more for premiums, closing networks, or narrowing networks, denying more things. And like, they're so profitable that they just keep doing that. And as patients, we're so used to the mentality that you have to have health insurance that we're just willing to suffer through it. And even though there's other ways of doing it. I mean, but as this pain point gets reached by many people, including patients and physicians, more people are kind of figuring out like, hey, this is a real raw deal. I'm not doing this. And you're starting to see some change, albeit slowly, because the healthcare system, in contrast to, let's say, the tech sector, moves extremely slowly.
Yeah, I think it's fascinating is that, so I'm 56 years old, right? So I'm Gen X. But if you look at the generation after me, when I have some clients now that are in their 30s or early 40s, and they're like you, they're not even going into the industrialized insurance machination system. Like, it's just, they're like, no way, you can't. You're like, wait a minute, I've got $500,000 in freaking loans. How the hell am I going to do this? Right?
I mean, yeah. So for me, a health share is much more economical than an Obamacare plan, right? I mean, Obamacare plan is so expensive, and unless you have a subsidy, there's a certain select people who do, and it actually is affordable. But and the networks are razor thin. And there's so much, deductibles are sky high. Just the health share, just for me and my family being healthy, makes a lot more sense. But yeah, it's wild. I mean, like if you don't have income, you can get Medicaid. I mean, it's not. There's just so many problems with that whole system. But if I'm, I really am anti-insurance. So obviously, not just do I not take it, I also don't carry it personally.
Yeah. So what's a typical week like for you? So I'm sure, I want to go back to this because I'm sure some people are listening. He's like, oh God, how can he be making any money charging $29 for an office visit, driving around and doing it at home? He's going to eat up all his money in gas. Let's talk about work. Let's talk about how many hours you work in a week, right? How many patients you're seeing. And while I don't want you to disclose like the actual dollars that you're making, but compared to what you would be making if you were working in the Viking slave ship of hospital groups.
Gotcha. So, so I'm not charging $29. So when someone books a visit with me, I generally charge $375. This is for an hour of my time. And that generally includes one steroid injection. If they need more, then I'll charge more. So that's the cost of one visit, right? For 1 hour. And then this is not factoring in like any sort of procedures I do, any sort of medical legal work or anything else. This is just pure cash pay patients. And then my overhead, because I don't have an office or any employees, my wife works with me. My biggest expense is malpractice. So I think I haven't calculated in a while. Last time I calculated my daily cost, it was like $70 or something like that to run my practice.
Wow.
But it may be $100. because think about it, you get rid of an office and you get rid of all the staff. I mean, you don't, what are you paying for? Medical supplies aren't that expensive, at least the ones I need. A lot of it's insurance and junk, which anyways. So if you go out and you see 3 people in a day and you charge them about $400, that, and $100 of cost of running it, that's $1,000 you made for a pretty small amount of work, and you string that along for, I don't know how many work days are in the week, but you can easily see that you can do pretty well with a minimal effort. And if you say seeing 3, you see 6, it changes it. You start adding in procedures, you add medical legal work, you can do pretty well with a minimal amount of work. So, but the problem is getting patients. So it's not like you always have a ton of patients. So I'd say in a typical work, I work as much as I have available, right? And I do have days where I'm somewhat busy, nothing compared to what I used to. But with this model, I think you can max out at like 6+ people a day. 6, 7 kind of is probably the most you could do. That's pretty good money right there. But yeah, I mean, I don't know. I'm probably seeing like 10, 12 patients a week, maybe an independent medical evaluation, maybe something else. I'm probably working less than 20 hours. A lot of time with my family. I'm not going into hospitals. I'm not rounding. I'm not taking call.
You're present with the kids. You're present with the wife, right?
Yeah. Oh yeah. That's super important. I mean, for me, I put, a lot of people say they put family first, but then they work all the time. So you really put work first. I really do try to put family first.
I'm expecting to see the kids. I'm kind of disappointed the kids haven't run by. That's usually my favorite part of these interviews.
And the other one's upstairs watching Spider-Man with my wife, who I told I was doing this, so she's keeping her out. She's 2.
Spider-Man's pretty good. Maybe we should go up and watch Spider-Man instead.
Yeah, I know. Some pretty good stuff. Yeah, it's the cartoon, like little kid versions. But anyways, as a parent, young parent of young kids, you know all those sorts of things.
Yeah.
But anyways, going back, so I mean, I think, I'm definitely in the ballpark of like orthopedic surgeon salary, but I work a significant amount less. As time goes on and I get busier, I think that I'll probably make more than mostly any other orthopedic surgeon. And, besides the people who have giant practices or royalties or patents and that sort of thing, and working half as much if you can fill the model out. But it takes time. I mean, that's the hard part, is getting patients and building it up. Because then certainly in the beginning, I'd have days where I wasn't doing anything. Even now, every once in a while, I get days like that, or days where not a lot's going on. That's just kind of the nature of your own business. But yeah, I mean, a lot of people think that like, oh, he's just probably not making any money. I mean, if I'm not, that means I'm also not working a lot at all. So even I think the per hour work, you make significantly more. You just have a lot less hours.
How do you get patients? How do you go out and get patients? Because that is the number one issue of questions that I get. How do I get patients?
So yeah, it was hard. I mean, so I have good search engine optimization on my website, so people find me through the website. But really, it's about finding good referral sources in the community. So I have a list of people in the community and how often they refer per time period, per quarter. And then over time, you kind of figure out, all right, who actually refers to me? Who actually values what I do, and who really doesn't? And I found some excellent referral sources who bounce me people quite regularly because they know the value that I add. If anyone else ends up doing a practice like this, let's still save some time. You would think that it would be direct primary care doctors would be the best referral source, right? Cash pay patients, primary care. Yeah, you're laughing because you know this.
I know the answer to this.
You would think, right? And you would be wrong.
Yes, it would logically, it would make sense.
Logically, so in the system, those guys refer out all the time, right? Because they're overloaded. There's no time. Referral. When you're out of the system, they don't, because their value is basically keeping patients from going out to see anybody. So they don't really tend to refer that much. And also, this irks me a little bit, and this isn't true of all family med direct primary care docs. And by the way, I think it's the best care you can get. This is what I use for myself. But they also tend to do a lot of musculoskeletal care, I think, very inappropriately, because they're not really trained in it. They only send things to me like when they've tried a bunch of stuff and it's failed, which like maybe is fair, maybe it's not. But sometimes the things they do, I wouldn't do. So they're not a good referral source. Actually, who refers the most for me is chiropractors. They just seem
they're great. Yeah.
They're all cash pay. They're all cash pay. It's all musculoskeletal. And they understand what I do. And they're like, this guy needs a shoulder injection. Dr. Paull, can you come and see him and take care of his shoulder or hip or whatever? And I'm there. So them, and then some physical therapists as well, tend to be my best referral sources. That combined with, electronic website stuff. And then also just being in the community for a while, getting more medical legal work by doing some good reports and things. So it's just I don't spend money on marketing. So that's another reason my costs are so low. So it's just a slow word of mouth growth, which is the best, but also takes the longest.
The chiropractors, and I'm a huge fan of chiropractors, right? One, before this, I was at the chiropractor as a golfer of 50 years and somebody who works out a lot. Yeah, chiropractic is my friend. But the flip side of it is, and I have probably in my group in Business Mastery Fellowship, I think I have 4 or 5 chiropractors. Are you struggling to translate your amazing medical skill into cash-based procedures? We have the solution. It's called the Business of Orthobiologics. And we want you to join us. We host this event a number of times throughout the year. Myself and Dr. Ariana Demirs are going to teach you the science of medicine, and I'll teach you the science of business. And you'll find how to add $50,000 of cash-based procedures in the next 60 days, or we'll give you your money back from the event. Join us. Click the button below. You'll never attend an event like this ever in your life. It'll transform your life and your business. Join us. And it's so funny. They actually are like, well, I don't like to tell anybody that I'm a chiropractor because I don't want them to like think ill of me or something like that. I'm like, what, are you kidding me? Every single one of my orthopedic surgeons is looking for a chiropractor to bring business because it's the perfect marriage. It's the absolute perfect marriage. And they're great people, right? Like they're forward thinking. They think differently, right?
Yeah, they just, I think with chiropractors, I mean, they're much better at business than physicians because they have to be.
Oh God, yeah.
They just can't go out and get a job. I mean, they have to create their own business. Insurance kind of ices them out. So a lot of them end up not taking insurance. So a lot of them end up with these really nice cash practices just by necessity. So by necessity, they're all sort of forced into direct care in their own way. A lot of them are. So they end up being much better at business. That's one part. And with chiropractors, it's like lawyers or like doctors, like physicians, anybody else. They run a full spectrum, right? I mean, you've got ones that you really like and are good and ones that you probably wouldn't want to go to. So I think you can't really, same thing with lawyers. I mean, I don't think you can write the whole people off for profession. I mean, you have to meet the individual and judge them. Chiropractors run a full spectrum. You have ones that, hey, you got hurt, let's adjust you and do modalities and get you better, and people get better. And the other side of the coin is, well, I'm going to cure your wife's asthma. And I'm like, I don't think you will. So, I mean, there's I'm sure if there's a holistic chiropractor listening, they're really mad right now. But
don't worry, I'll hear from them, and I'm going to give them your number. So don't worry about it. You'll get the chance to talk to them.
No, I mean, but there's people that like that, who are into holistic care. And like, I don't get referrals from holistic providers at all. So like, that's another part of the referral game where knowing like, okay, this person's a holistic provider. I'm never going to get anything from them. So like, I talk to them, but I'm not going to pursue that. But again, with anything, it's a full spectrum. So I found it to be very good relationships for me. And, we respect what each other does. And, because I think as a physician and orthopedic surgeon, you're trained to be like, oh, chiropractors, they're doing God knows what. You think that, but especially spine surgeons. But honestly, a lot of people go to them with their musculoskeletal pains and they come out without any musculoskeletal pains. So, I mean, that's the same thing I'm doing, just in a different way.
And it's also the place. It's the place where a lot of people start, right? It's not going to be the perfect solution for everybody. I have a couple chiropractors, and what they do is they have like one of them has been a chiropractor for 20 plus years. So he has 12,000 patients, 15,000 patients. And now what he does is when they come in, his orthopedic surgeon partner that they own the regenerative practice together, he does an ultrasound scan on where they've been injured, shows them where there's the tear, and then presents a different solution to them. So it's a great solution. Now, are you doing any things like regenerative, orthobiologics, PRP? You doing any of that stuff, or you
I do a little. I do a little PRP, yeah.
Okay.
People are requesting it, and so far what I've done seems to have pretty good result. I wouldn't call it a regenerative clinic, but I do offer PRP. That's when people are looking for it. I have that, which I'm glad to have, to be honest with you.
So your friends that you went to med school with and were in residency with that have gone into this system, when you check in with them, what do they say to you? Like, are they surprised this is working? Are they envious this is working? Do they want to know how to do it, or they just ignore it because they feel like they fucked up and made a bad decision?
So I think that's a very good question. It's a very interesting question, very interesting as well. So there's difference between my friends in medical school and my friends in residency, right?
Yeah.
So I'll start with my friends in residency who are very much in the system. I think at first they're like, what is this guy doing? They know I quit my fellowship, and they don't really know, they don't think I'm operating that much. And if which I'm not. And in the world of orthopedics, a lot of people think that, which is, you're not operating like you're not doing anything, right? Which is just not the case. So I think at first they're like, well, I don't know, maybe he's just burnt out or doing something weird. And I think over time they see me keep doing it, and that, my revenue keeps rising, and they're kind of like, oh, I don't even know if they know what to think about it. I think there is a little bit of like, oh, I might have messed up there. but there's a little bit of kind of like curiosity, like he's still doing that? Is he making any money? Is he able to support himself? And I think as like one of them started to realize, like, I think he's making a good amount of money, and so I think there's slow realizations there. But family med docs hit the pain point so much earlier. So direct care is more of an established thing. Direct care with orthopedics is very much not. So I think there's that. In med school, I've actually had a good chunk of people approach me, friends, who are like, I need to get out of the system. I need to sort of do what you're doing. And so I help them with that, which is crazy because I graduated med school in 2013, right? So in practice, like 5 years or plus minus. And a lot of them after 4 or 5 years are like, I'm done with this,
Yeah.
It's really bad.
Yeah. We hear it all the time. It's amazing.
I think my generation of docs, like, you don't have a 30-year shelf life. There's no 35-year shelf life. I mean, you're seeing 5-10 years, I think, before people are over the profession, which is crazy considering the amount of time you put in. But after all that wearing down through training, I mean, I have one friend, she's a pediatric interventional radiologist. She's on call Q2. Another friend was a neonatologist, just being worked to the bone. There's an ER doc I went to school with who I'm not super close with, but apparently he has like an aesthetics practice and stopped doing ER. And there's someone who's direct care, dermatology. There's that friend from med school. So, I mean, there's a good chunk of people that I personally know who are sort of figuring out other ways to do it or getting out, which is wild. So on that side, that tends to be more med school. That tends to be more like, whoa, because it's different specialties. Like, I need to do what you're doing. Like, let me know how you do it. Versus residency, more orthopods where they're just like, well, he's still doing that? Is that really working? Is he making money? And like, I think the tide's starting to turn a little bit, and I think it will turn eventually when as time moves on. But it's really crazy, actually. I mean, docs are burning out fast. I mean, you're not getting end of career burnouts; you're getting like early career burnouts.
Yeah, I could story after story after story. I mean, one of my top clients as a chief of surgery has overseen 16,000 joint replacement surgeries as a chief of surgery, and highly compensated. Walked in one day and they said, hey, we're your 3-year contract, we're going to cut your fee in half. Yep. And he basically said, F you, and went and started his own practice. This was a year ago, and they're doing great. They'll do a couple mil, I mean, in their first year, and he's never been happier. Right? He has the office, right? He has staff. He's decided to go that route. And I think that's what people don't realize is there's so many there's not a way to do non-insurance business.
Right.
It's really about your personality. Like, I could see as a young father and knowing what I know about your generation of wanting to be involved in their kids' lives, like, this is perfect. You don't need a Maserati. You don't strike me as a Lamborghini kind of guy.
No. I've got 2 Subaru Foresters that I bought used. And so, yeah, of course,
how dare you as a doctor not get into debt?
I know.
What are you thinking, Dan?
I know, my gosh. I didn't, that's another thing. I mean, I think it's a terrible idea to really, unless you have tons of cash lying around, like if I wanted to, I could buy a Tesla today. But I don't want to. I mean, we get out of training. We're like, I'm delayed gratification. I deserve this. It's encouraged. You buy the really nice house. You buy the really nice cars. Your kids go to private school. You sign this hospital contract with a non-compete. Contract comes up for renewal, and like your friend, the second time around is not so friendly as the first time, and you golden handcuffed your stuff, and you're stuck and you're miserable in this job you hate because you bought too much stuff. So for me, the stuff is like in a direct contrast, a direct like countering autonomy. So the nicer stuff that I buy, the less autonomy I have, at least at this point in my life. So I still buy quality things. I still go on vacation. I still go out to eat. I just don't need the nicest of every single thing, especially the big stuff like houses and cars. I feel like we have a very nice house in a nice area. Do I have the most expensive house? No. Same thing with the cars.
Are you more involved in your kids' life? Are you more involved in your kids' life and your wife's life than 90% of your neighbors?
I'm around all the time. Yeah. I mean, first year, my first daughter, I got 2 daughters. I was finishing residency. So the first year of my daughter's life, I was still training. I was very busy. And then the first year of my second daughter's life, I was around a lot. I'm like, man, I missed a lot of that first year. So you don't even realize how much you're missing. And I mean, I think the medical profession will just kind of take from you. And like, you really have to put your foot down and make some real changes to have it stop taking from you and actually start giving you stuff, otherwise it'll take everything from you.
Yeah. That's one of the bigger questions I get a lot is, I was talking with a doctor the other day and he goes, well, God, I just bought a Tesla and we just got a new house. You want me to start a new practice? And I'm like, I mean, one, you can start it right inside your insurance practice in a heartbeat, but two, it's like, oy vey, you know? I mean,
Yeah, it's a problem.
frustrating.
Bad business,
It's a
bad with
problem.
money.
Yeah, I know you got to go here in just a minute. Tell me what the future looks like 5 years from now. Where do you see medicine going? If you had to bet on what's going to be happening, where doctors are going to be and what the industry is going to look like 5 years from now? What do you see?
Sure. So I don't see insurance or hospital conglomerates slowing down. So I think whatever we experience, that sort of core of stuff that you hate, it's just going to be more of that. It's going to be worse. Reimbursements are going to be lower. There's going to be more administration. Patients are going to be more higher volume. Everything that you can think of that you dislike is going to be more of that in the future, because these entities are making multiple, they make stupid amounts of money off of it. And so they're not going to stop. They're going to keep pushing in that direction. So more of that, increased status quo. But I think you're also going to see more docs sort of defecting out, and you're going to see direct primary care grow more, and you're going to see direct specialty care start to grow. And actually, I created a course to sort of replicate my practice. If you go to insurancefreemedicalpractice.com, it's there. And it gives 35 CME credits, and it basically helps you avoid all the mistakes I made when I started. But anyways, I think you're going to see more direct care as people kind of defecting out. It's going to be slow, but that I think is what it's going to be. It's just going to keep continuing on. The system's going to get worse. More and more people are going to leave. It's going to create an alternative ecosystem, and we'll see where that's at.
What do you think? You think there's going to be a tipping point where all of a sudden that there's just not enough doctors for the hospital system?
Yeah, possible. It could be a decade or plus before that, because if this alternative system starts really being a much better existence and hospitals can't get anybody, then they'll make it better for doctors. So it'll in turn increase the quality of life for a lot of these doctors. You know what I mean? So if a doctor's like, well, if nobody wants to do work for a hospital,
or they'll try to outlaws, or they'll outlaws. They'll work with Congress.
Yeah, it's going to be hard, right? Because yeah, that's another thing, like legal, like outlawing. I mean, here's the thing, right? Most of the laws are not, they're all reimbursement related, right? So all the regulations are reimbursement related. You have to do A, B, C, D, E, F, G to get paid. But once you remove that, there's not very many laws, like laws telling you what a physician you can or can't do. I can legally, not that I would do this, I would never do this. I can legally be like do pathology, dermatology. I could legally do cardiothoracic surgery. Now, no malpractice would cover me, and I would never do that because I don't know what I'm doing. But it's not illegal for me to do that. It's not illegal to someone to charge cash unless you're opted into Medicare. They can try, but again, it's an elusive, how do you stop it? And I think right now it's so small, they don't even care. They're making so much money. It's like a fly on the radar that they could care less. So by the time they do care, it's going to be hard to sort of prevent that.
At some point, they'll realize that we are their Jimmy Stewart and It's a Wonderful Life to Mr. Potter, and they'll try to figure out a way to eat us. And when I say us, even though I'm not a doctor, I feel like I'm a champion in this space. But yeah, I mean, at some point we're going to be cutting into their money, and they're going to want to try and figure out a way to put us out of business legally. They have a history of doing that. All businesses do. So
yeah, I mean, but it's disruptive technology in a certain sense. So what they'll see is that we're grabbing bottom parts of the market right now, and they don't care about that. You take your cash pay and stuff they don't want to do. And as time goes on, we'll sort of move up market, and they'll move farther up market, being like, well, we still all they'll do all the expensive stuff until we find the ability to do that too, and then they have nowhere to go. I mean, if they can try what they want to try, but I think it's going to be hard to stop the whole direct care movement, basically saying that people can't pay cash to see a doctor. Yeah. And plus, besides that, there's other sorts of avenues. You still have personal injury, you still have medical legal work, you still have things that are not covered by insurance, like regenerative medicine. There's all sorts of ways. And the nice thing about direct care practice is you can brand it to your own personal way of how you want to do things. So, I mean, it'll very much reflect what you want to do and what you don't want to do. Cool.
All right. Hey, tell everybody how they can get in touch with you. I know you're on LinkedIn, by the way. If you are not following Dr. Paull on LinkedIn, you need to. His stuff's awesome. I don't know where you get your moderately, is that from the Northeast where you get your moderately sarcastic sense of humor?
I don't know. Yeah, somewhere along the lines.
Because it's really good.
I don't know.
I love it when you post stuff.
Oh my gosh. Yeah, sometimes I have to give it to people.
My favorite post, I think, of all time was the one where you posted about the EMR in the campus that looked like Harry Potter. That was my favorite, I think.
Oh, you like that?
Yeah, it was great.
You know what? I like that so much is because, for those who aren't listening, we're talking about the Epic Medical Campus I think it's in Rochester, Minnesota. And the United States is considered the wealthiest country in the history of the world. All right. And 20% of the GDP is healthcare, which is it's mind boggling amounts of money.
That's
and you rarely ever,
I never knew that. I never knew that.
you rarely ever get to see like what the wealth actually looks like, because it's just an insurance company ledgers and who knows. But this is an example of who actually get to see the wealth that exists in this system. And if you look at a YouTube video of the Epic Medical Campus, you'll see why, because they have all sorts of themed buildings and it looks cool, but it's also extremely disturbing at the same time.
Mm-hmm. Yeah, and it's built on, hey, your fees that you pay them that you can't, once you get ingrained with an EMR, it's hard to get out. I witness it all the time. So
yeah, I've got a super good solution for that.
Oh yeah, so tell everybody, I love this. And then what's your solution for an EMR? I love this.
So EMRs are expensive because they have to buy or rent the CPT codes from the AMA, and that's how the AMA makes most of its money, from lending out these CPT codes. And so they're all billing machines. That's why they're so expensive. But if you don't need to do that, you can really go bare bones and be fine. So I have Google Workspace, and you can make it HIPAA compliant by signing a business agreement. And then I have templated Word documents, which with my own letterhead and my own logo and everything. So they look like regular notes, and I just make Word documents and I save them as PDF and send out the PDFs for orders. The orders work great, and for notes, that's what I have. I mean, and so it's
what does that run you per month? It's just compared to the thousands of dollars. $36 a month. Yeah,
I could do it for less if I wanted, but I have like the really upgraded plan, so I pay a little extra. But it's just me and my wife. She pay per user, and you get all the Google stuff that comes with it. It's all HIPAA compliant. So yeah, I had to give it to someone the other day. Athena was calling me, and I was like, "You guys got to stop calling me. You tell them to stop, they don't stop. It's really annoying."
No, they don't.
But
they call me, and I'm not even a doctor. I swear to God, they call me.
I know.
I'm like, what the hell?
I had to be professionally rude, so they would hopefully be like, "I don't want to talk to this guy again in 6 months." We'll see what happens when they call me in 6 months again, probably.
Yeah.
But there's just so many things like that in the cash-based world that I figured out that I think can just save you so much money and time and frustration. So, but yeah, if you want to feel sick, and just watch the YouTube video of the Epic Medical Campus.
Yeah, it's great. And then give them your site again. I think the more we can get the information out to people about how they can have an option outside of the insurance system, the better off medicine is going to be. So what's your site again?
So you got a few things. So the website with the course, where if you wanted to replicate my practice and get CME credits, is insurancefreemedicalpractice.com. That'll take you to it to buy that course. My website's easyorthopedics.com, where you can find out more about me. And then on LinkedIn. And then I also have a YouTube channel as well. It's more just informational stuff. I did it early enough, so it says youtube.com/@orthopedics. So I was able to get that. Once they introduced those tags, I was able to grab it real fast. So I'm proud of that. But that's more just about like, how do I know if I sprained my finger kind of videos.
Well, you mean as opposed to like going to WebMD and thinking that you have cancer? So
yeah, right. Exactly. Everything's cancer. Yeah, LinkedIn is more of like the content that I post that we're sort of talking about.
Yeah, it's great stuff. Well, Dr. Paull, thank you for taking the time, and I love hearing the journey. I'm glad to hear that there's another one who has figured out how not to be part of the system and create their own system that works for their lives, their family, and their spouse. So kudos to you, my brother. Kudos to you. So,
well, thanks, Matthew, for having me on. I appreciate it.
You got it, brother.